All right, well, I'm going to get started. My name is Claire Healy. I'm going to be your moderator for tonight's event. I'm one of the managers in the Smilow Cancer Genetics and Prevention Program. I've been a genetic counselor for almost 16 years, and it's my pleasure to kind of briefly introduce you to the Smilow Cancer Genetics and Prevention Program and our speaker tonight. During the presentation, we want to encourage you to feel free to use the Q&A feature. We'll be answering some of your questions in real time and then having our speaker answer some of our questions at the end. I did want to just talk a little bit about the Smilow Cancer Genetics and Prevention Program first, and then I'll introduce our speaker. So the Smilow Cancer Genetics and Prevention Program sees patients across the state of Connecticut. We're very fortunate to have office locations in Greenwich, at Greenwich Hospital, and through Bridgeport Hospital in Trumbull, Connecticut, our main location in New Haven, and we also see patients at Lawrence Memorial Hospital at the Waterford Cancer Center. We also have a relationship with St. Francis Hospital up in Hartford. So we are very proud to be the cancer genetics home for a number of patients across the state of Connecticut. And our team consists of physicians with expertise in hereditary cancer syndromes, as well as advanced practice nurses, genetic counselors, genetics clinical coordinators, genetic counseling assistants, and our fabulous administrative team. And we're all dedicated to really trying to provide the highest level of care for patients whose personal and/or family history places them at increased risk of developing cancer. So tonight, I'm very excited to introduce you to Carson Nestler, one of our more experienced genetic counselors who will be providing our presentation. Carson received her Master's of Science degree in Human Genetics from The Ohio State University in Columbus, Ohio. Before her graduate studies, she worked in an academic laboratory studying targeted therapies for leukemia. And in her role as a genetic counselor, she's passionate about educating patients and their families about the potential causes of cancer, strategizing ways to screen for and prevent cancer. Carson's board certified by the American Board of Genetic Counseling and licensed to practice as a clinical genetic counselor by the Connecticut Department of Public Health and soon to be Department of Public Health in Rhode Island. She's proud to be part of a collaborative, compassionate team of providers in our program, and she's really a fabulous genetic counselor. So I'm going to turn it over to her for the rest of the presentation.
Well, thank you so much, Claire. That's really kind. I'm really excited that everyone has joined us tonight to talk about cancer risk factors. So like Claire said, I'm a genetic counselor at Smilow in the Cancer Genetics and Prevention Program. And this is something I talk about pretty much every day. So I thought it'd be maybe an interesting topic for some other people to hear a little bit more about. So the title of my talk officially is What's My Risk? Understanding Cancer Risk Factors. I should probably share my screen. So I'm going to do that now. All right, put it into presentation. Okay, can you see that okay, Claire? Okay, wonderful. All right, so if you've ever had any of these questions, then you're in the right place tonight. Today we'll be reviewing the various factors that can contribute to a person's cancer risk, and we'll discuss why it's important to characterize your estimated cancer risk. We'll talk about how we use a risk estimate to guide cancer screening and management practices, and then we'll discuss some examples of how this information can be obtained and then actually put into action. So, cancer is a complex disease, and the likelihood of developing cancer is based on a combination of various risk factors, some of which might occur by chance and are known as sporadic risk factors, others of which are shared amongst family members and may be known as familial risk factors. In some cases, others may be present in our DNA, and we call those hereditary risk factors. Every person has some risk of developing cancer. In some people, their risk to develop cancer might just be higher because they have certain risk factors that other people do not. So sporadic risk factors, and we'll talk about each of these different types of risk factors in a little more detail, but just to kind of present generally what we mean by these different types of things. Sporadic risk factors are typically things we might encounter during our lives. We might encounter things in our environment, such as chemical exposures, that can increase our risk of developing cancer. Other risk factors are more lifestyle-based, so maybe diet or exercise. Even just the natural aging process can influence our cancer risk. So, the older we get, the more likely it is that we might develop some type of cancer. Most cancer risk factors are initially identified in studies where scientists take a look at large groups of people, and they compare those who develop cancer to those who do not. These studies may show that the people who develop cancer are more likely to have encountered certain types of risk factors, which might then suggest that those risk factors could have somehow contributed to them being diagnosed with cancer. We also recognize that there may be other types of risk factors that have not yet been studied, and so we don't necessarily know how they contribute to our risk of developing cancer, but certainly there are things like that out there. It's also possible for family members to have maybe one or multiple risk factors in common. So for example, in many cases, family members might grow up in the same place, same geographical location, or maybe even the same town, same side of the country. Maybe they ate the same types of foods. Maybe they lived in the same house. Family members might even share, family members might also share some minor genetic risk factors that might be considered familial risk factors. And these often result in multiple relatives in a family being diagnosed with maybe the same type of cancer. Lastly, in some cases, people are actually born with a higher risk of developing cancer because of risk factors present in their genes, their DNA. These types of risk factors can be passed from one generation to the next in a family, and they might also result in multiple relatives being diagnosed with the same type or related types of cancers. If a person is born with a higher risk of developing cancer, it also means we might see those people or multiple people in a family diagnosed with cancers at younger ages, like maybe under the age of 50. So we've talked about just broadly these three types of risk factors, but I want to provide a little more detail, a little more context. So first we'll talk about sporadic risk factors. There are multiple different types of sporadic risk factors, kind of grouped into three different main categories, being lifestyle-based, environmentally based, and then other kind of factors that might not fit into those two previous groups. So let's start with talking about some of these lifestyle-based risk factors. So tobacco is a relatively common risk factor for cancer. It is the leading preventable cause of cancer and cancer-related deaths. The dangers of tobacco use exist not only for cigarette smoke, but also for cigar, pipe, chewing tobacco, and secondhand smoke. 40% of all cancers in the US are linked to tobacco use, and it's not only associated with lung cancer. Tobacco use increases the risk for people to develop multiple different types of cancers, including that of the throat, mouth, voice box, esophagus, stomach, kidney, pancreas. The list goes on, unfortunately. It's never too late to quit. Quitting tobacco use at any age can reduce the risk for a person to develop cancer. And for people with a history of tobacco use, getting screened for some of these cancers might lead to fewer people getting these cancers, or even fewer people passing away from these cancers. Alcohol consumption has also been linked to an increased risk to develop multiple types of cancers, including that of the mouth, the throat, the voice box, esophagus, and liver. To reduce the risk of alcohol-related health concerns, adults of legal drinking age may choose not to drink or to drink in moderation. Drinking in moderation looks a little different for men compared to women. The American Cancer Society recommends that people keep their alcohol intake under 7 servings a week for women and 14 servings a week for men. The type of alcoholic beverage being consumed doesn't appear to be significant. But overall, the amount of alcohol someone drinks over their lifetime appears to be the most significant factor in raising cancer risk. Next, being overweight or having obesity does increase risk of developing cancer. Obesity and excess weight are associated with an increased risk of developing multiple types of cancers, including that of the colon, endometrium, breast, kidney, esophagus, and other types of cancers as well. Body mass index, or BMI, is one way to determine if your body weight is higher than we typically recommend. So exercise, a diet focused on whole foods, and working with a medical provider can sometimes help people reach a weight that may be associated with a lower cancer risk. Physical activity is an example of a factor that can actually reduce a person's risk of developing cancer in some cases. Greater physical activity is associated with a decreased risk for many different types of cancers, with the most significant reduction of risk being for colon and breast cancer. Physical activity is defined as any movement that uses skeletal muscles and requires more energy than resting. And you can start small. Maybe it means you go park your car a little bit further from work each day, or maybe you take a walk around the block when you have a break from work. Maybe you take the stairs instead of the elevator, or maybe you're even seeking out activities that you enjoy, things like dancing or hiking with friends. Maybe you even just incorporate more physically active yard work like gardening or raking. So some of these things can be a little more approachable, but we encourage you to discuss appropriate exercise plans with your healthcare providers. There are a variety of specific dietary factors, vitamins, and supplements that have been suggested to possibly be associated with either increased risk or decreased risk for cancer. Although most of these dietary factors have not been consistently shown to affect cancer risk in various studies, it's generally recommended that people would eat a diet that's rich in fruits, vegetables, whole grains, and low in saturated or trans fats, red meat, or processed meat to maintain kind of stay on top of their cancer risks. So now let's talk a little bit about things that we might encounter in our environment that may be associated with cancer risk. So one such risk factor is ever present and can be very difficult to avoid, and that's the sun. Radiation from sun exposure is the #1 cause of skin cancers. The total amount of sun exposure over a person's lifetime can affect their risk to develop skin cancer, particularly if they have had blistering sunburns or repeated sunburns. In addition, UV exposure from tanning beds significantly increases the risk of melanoma. In fact, individuals who start using tanning beds before the age of 35 have about a 75% higher chance of developing skin cancer compared to those who have forgone tanning beds. All individuals are encouraged to avoid tanning beds and limit their sun exposure by wearing hats, sunglasses, other types of protective clothing, and ideally wearing a broad spectrum water resistant sunscreen with an SPF of at least 30 on a daily basis, and that's year round. Lastly, an estimated 17% of all cancers are associated with infections. So for example, human papillomavirus, or HPV, is associated with an increased risk for cervical, anogenital, and head and neck cancers. Hepatitis B and hepatitis C are associated with increased risk for liver cancers, and human immunodeficiency virus, or HIV, is a risk factor for certain types of sarcoma and lymphoma. Most of these infections are spread through blood or bodily fluids, and thus can be spread through sexual conduct, and that's including oral sex or reusing needles. So methods of prevention may include following safe sex practices, using needle exchange programs, and regulating tattoos. In addition, vaccinations for HPV and hepatitis are available, and the HPV vaccination is recommended for children who are between the ages of 11 and 12, although this can be administered in children as early as age 9. Lastly, there's other types of risk factors that may not fall into the environmental or lifestyle risk category. So just a couple examples. Age, like we talked about, is a known risk factor for cancer. So the older we get, the more likely it is that we might develop cancer. In addition, asbestos exposure has been associated with an increased risk to develop lung cancer and mesothelioma. There's also certain medical conditions that may increase risk for certain types of cancers. Hormone levels over time can potentially influence a person's risk to develop cancer. And then we have to acknowledge that there may also be some other types of risk factors that we just have yet to identify. So we've talked about some of the things that can be encountered during life, but now let's talk about what happens when a person's born with a higher risk of developing cancer. So hereditary risk factors, these occur when a person is born with a higher risk of developing cancer in their lifetime because of something in their genes. We have around 25,000 different genes in our bodies, which we're all born with. All of our genes serve different functions, but they generally act like instruction manuals that tell our bodies how to work properly. Some genes tell our bodies how to prevent certain types of cancers. We have 2 copies of every single gene. We get one from our moms, the other from our dads. So when a person is born with a pathogenic variant in one of their genes, it just means that their gene is damaged and can no longer perform its proper function. So if that gene was supposed to tell that person's body how to prevent cancer, that means that that person, if they have a pathogenic variant in that gene, has one less genetic set of instructions helping their body to prevent cancer. So those people have an increased risk of developing cancer compared to people who do not have these pathogenic variants. And you might sometimes hear people, doctors, other medical providers refer to pathogenic variants as mutations, and really they're essentially the same thing. I just tend to refer to them as pathogenic variants because that's kind of what us genetic counselors tend to do. So we can identify whether a person with a hereditary risk factor has a hereditary risk factor by doing genetic testing. Genetic testing looks for these pathogenic variants or mutations in a person's genes. When a person is born with a pathogenic variant, it's present in every single cell of their body. So that includes their egg cells and their sperm cells, which basically just means that they can also pass these pathogenic variants down to their children. So genetic testing can often provide information about cancer risk, both for the individual who is doing genetic testing, but also for their relatives as well. Genetic testing is often performed using a blood or a saliva sample, although testing can also be performed on other types of tissues like a cheek swab or even a skin sample. So some of you might be wondering, do I need genetic testing? And the answer is, it depends. So genetic testing can be helpful if you have had cancers diagnosed at young ages. So for example, people who are diagnosed with breast or colon cancer under the age of 50 may be candidates for genetic testing. If a person develops 2 separate cancers, such as 2 separate breast cancers in one person, or maybe a person has had breast and ovarian cancer, this makes us wonder maybe that person was born with a higher risk of developing those cancers. Some hereditary risk factors are associated with an increased risk for multiple different types of cancers. Like, for example, there are genes that tell our bodies how to prevent both breast and ovarian cancer. And then there are other genes that tell our bodies how to prevent both colon and uterine cancer. So if one person develops 2 of these types of cancers, maybe breast and ovarian or colon and uterine cancer, it makes us wonder if maybe they were related to the same hereditary risk factor, and that's a good reason to think about potentially doing genetic testing. If there are multiple people in your family with the same type of cancer, or maybe related types of cancers, that's another good reason to think about genetic testing. So for example, if let's say a mother and 2 of her sisters were all diagnosed with breast cancer, that would raise our suspicion that maybe there is a genetic risk factor being passed down through that family. Let's say one relative had ovarian cancer and multiple other relatives had breast cancer. Again, that's another reason for us to be considering the possibility that that person has a genetic risk factor that is associated with breast and ovarian cancer. Then, thinking about other genes, other risk factors, if maybe multiple relatives in one family have colon or uterine cancer, this is also another reason to consider those types of genes and also think about genetic testing. There are certain risk factors which are relatively rare, but are more commonly diagnosed in certain types of cancers that are relatively rare, but are more commonly diagnosed in people who have certain hereditary risk factors. So I think about pancreatic cancer, ovarian, male breast cancer, and some aggressive types or metastatic types of prostate cancer as being relatively uncommon. And those are, the types of cancers where people who have them may want to consider doing genetic testing to potentially rule out or reduces the chances that there was some hereditary cause for that cancer type. We also consider a person's unique ancestral origin when thinking about genetic testing. So for example, Ashkenazi is a Jewish population that migrated from the Middle East into Eastern Europe many, many years ago. Several of the original founders of that Ashkenazi Jewish population had certain genetic risk factors or hereditary conditions. And after they settled into Eastern Europe, people within this group tended to marry, different people within that group. And this led to certain mutations or genetic risk factors becoming more prevalent within that population. So because of this, there are certain kind of founder mutations or just pathogenic variants that are more common in people who have Ashkenazi Jewish ancestry. So that's always something that we just consider. Lastly, there are hereditary risk factors that by nature, these risk factors run in families. So if you have a relative who's been diagnosed with, has a hereditary syndrome or has one of these hereditary risk factors, pathogenic variant in a gene related to cancer, it's reasonable for you to seek out some assistance from your doctors to try to see a genetics provider, a genetic counselor to discuss the chances that you could have it too. So we often think about who should undergo genetic testing. If I've already had cancer, do I need to know this information? Or if I don't have cancer, do I need to know this information? Realistically, if you or any of your family members have a cancer history that matches any of the things that I just went over, I do think it's reasonable for you to talk to your doctors about the option to pursue genetic testing or to at least meet with a genetic counselor to discuss it a little bit further. Typically, genetic testing is the most helpful when it's performed in a person who's already had cancer. If anyone in a family is going to have one of these genetic risk factors, it might be most likely that we'd identify it in a person who's already developed a cancer. Not every person in a family has these hereditary risk factors. So genetic testing, why are we doing this? Why would we want to identify a hereditary risk factor? Identifying a pathogenic variant in a cancer gene allows individuals and their doctors to more accurately estimate their chances of developing cancer. Oftentimes, increased and more frequent cancer screening is recommended. And in some cases, people may even consider preventative options, such as taking certain medications or pursuing preventative surgeries to try to reduce their risk or even prevent the chances of developing cancer. For people who have already developed cancer, understanding more about their cancer risk estimate just it helps maybe in their decision-making about how they would want to pursue cancer treatment as well. So one example of this would be that if a woman has breast cancer and she learns that she has a high risk of developing a second breast cancer, a new breast cancer later in her life, she might choose to have a surgery such as a bilateral mastectomy to remove as much breast tissue as possible in an attempt to reduce her risk of developing breast cancer again. Lastly, genetic testing may help to inform the cancer risk estimates for other family members so that they can also pursue these types of things. So, we talked about a couple different types of risk factors, again, sporadic risk factors, hereditary ones, but what did I mean by familial risk factors? Sometimes people have questions about this. So I think about this as let's say you have a family history of cancer and genetic testing, you do genetic testing and the results were uninformative, which means it did not identify any hereditary risk factors. What would you do now? Well, I would be thinking about the fact that we have ruled out, or at least greatly reduced, the likelihood that you have some kind of genetic or hereditary explanation for that cancer history. But then we think about what other types of risk factors these relatives, maybe multiple relatives with the same type of cancer, what do they have in common? Well, that brings us to familial risk factors. So in certain cases, people who have a family history of cancer might still have a higher risk of developing that cancer, even if a hereditary cause is not identified. So this is what we mean by these familial risk factors. These can be due to other types of risk factors that a person might have in common with their relatives that develop cancer. It's difficult to know or to characterize what these other types of risk factors could be, since this isn't something we can exactly test for like we can for the genetic risk factors. Perhaps these could be things that are more environmental or lifestyle based, but again, it's just difficult to know exactly what combination of risk factors may have caused a cancer in the family. Family history is actually an extremely important tool. The family history can help to determine your cancer risks and appropriate screening recommendations. For example, people who have a first-degree relative, which means their parents or their sibling or their children, if they have a first-degree relative with colon cancer, they would be recommended to start their colon cancer screening earlier and start having colonoscopies and do these more frequently than we would recommend for people in the general population who don't have a family history of cancer. And that's irrespective of genetic test results. So that's something that we don't necessarily need to have a genetic risk factor known about to make that type of recommendation. So it's really important to share more information about your family history with your providers. So these could be providers in your primary care, a gastroenterologist, a gynecologist. This information just helps them to create more accurate cancer screening recommendations for you. It might even help them to plug you in or connect you with doctors that can do cancer screening for you that you otherwise hadn't been seeing. So we'll talk about a couple examples of this in a minute. But it's really important to know about your family history, and it can be difficult for that to do that. Especially if people don't necessarily talk about these things growing up. So, perhaps at your next family reunion, maybe at Thanksgiving, conversation dies down, you might want to consider asking some of these questions. It's particularly helpful for your doctors to know how your relatives had passed away, at what ages they've passed away, and ultimately, what's most important for knowing about cancer risk factors is whether any of your relatives developed cancer. If I was asking about family history, I'd want to know if anyone had cancer multiple times, or really how old were they when they had their cancer. I'd want to know, if they did develop cancer multiple times, was this a whole new cancer, meaning it was totally different than the first diagnosis? Or was it a recurrence? So it's the same cancer that maybe came back in the same location or maybe a different location in their body. It's also important to inform your doctors about your ancestral origin. So especially thinking about if you have any Ashkenazi Jewish ancestry, so that we can consider, if there's any other type of cancer screening or genetic testing that would be available to you. So what's the benefit of doing cancer screening? Ultimately, knowing about our cancer risk leads us to this question. The overall goal of doing cancer screening is to reduce cancer morbidity or reduce cancer illnesses, and reduce mortality, which is cancer-related death. Cancer screening tests can help to detect cancer at earlier stages when, even before symptoms occur, before you would have, maybe you don't even know that this is happening. And at those stages, typically cancers are a little bit easier to treat. Screening tests can sometimes even help to prevent cancers from developing in the future. So for example, colonoscopies can help to prevent colon cancer. It's important to know what the likelihood is that you'll develop cancer in the future so that your doctors can just be proactive about your cancer screening and make sure that you're doing the appropriate degree of screening using the right technologies, the right types of imaging studies, or other types of things. So how do family members and other risk factors affect these cancer screening recommendations? Individuals who are estimated to have the average degree of cancer risk are recommended to do kind of standardized cancer screening. So, for example, the average woman would start her breast cancer screening with annual mammograms when she turns 40. The average person, so men and women, would start their colonoscopy screenings when they turn 45 to screen for colon cancer. That's just because we all have some baseline risk, some degree of risk to develop these different types of cancers. But of course, there are some factors that can alter these recommendations. If a person has a family history of cancer, their cancer screening recommendations might look a little different. So, for example, women with a strong family history of breast cancer might consider including breast MRIs in their annual screening routine, maybe in addition to their mammograms. Women who have a family history of early onset breast cancer, meaning they have a relative who was diagnosed with breast cancer before they were 50, they might be recommended to start their breast screening at a younger age than 40. So, just all things to consider, when thinking about the timing, the frequency of different types of screenings, and the type of imaging that we would be recommending. Another example would be if someone has a family history of early onset colon cancer, they might be recommended to start their colon cancer screening younger than the age of 45. For individuals who have other known cancer risk factors, such as a personal history of colon polyps, this might also impact their cancer screening recommendations. For example, people who are identified to have colon polyps might be recommended to undergo colonoscopies more frequently than other people. So just as an example, maybe they'd be recommended to have their colonoscopies every 3 years instead of every 10 years. So now that we've talked about cancer risk factors, we know a little bit more about what they are. We've talked a little bit about how these can inform our cancer screening recommendations. So now let's come together and put our knowledge to the test with a couple case examples. So our first patient is Sarah. And just, this picture here, this is a diagram of Sarah's family tree, which in genetics we call a pedigree. The women are denoted in circles, and the men are squares. So just to help kind of looking at this image, this is something that I draw almost every day, if not multiple times a day. So Sarah's circle, Sarah's our patient, and she has a little triangle pointing towards the left-hand corner. And then below her are her children. She has a son and a daughter. Next to her are her siblings, and above her are her parents. But we also see that she has aunts and uncles and grandparents and cousins here as well. Now, Sarah's a 38-year-old woman. She has no personal history of cancer. And she was, her mother was diagnosed with pancreatic cancer when she was 49. Her maternal grandmother was diagnosed with breast cancer when she was 50. Her maternal uncle was diagnosed with breast cancer at the age of 70. And her paternal first cousin was diagnosed with prostate cancer at the age of 55. So Sarah meets with the genetic counselor to review her family history, and they discuss that her family history raises some concern for a possible hereditary cancer risk factor. In the appointment, they discuss different types of hereditary cancer syndromes that seem to be potentially more likely based on her family history of cancer. They discuss genetic testing options, and they talk about some of the benefits and the limitations of doing genetic testing for Sarah. Sarah decides ultimately that she wants to pursue genetic testing. And Sarah's test identifies a pathogenic variant in the BRCA1 gene. So what does this mean for Sarah? Now we know a lot more about Sarah's estimated cancer risk, and it's a lot higher than we would have previously known if she hadn't done this genetic testing. For example, this table here is just kind of showing the risks that we know that the average person may have to develop these cancers in the left column. In the the farther right-hand column, this is talking about the cancer risks that we'd estimate for someone like Sarah, who has a pathogenic variant in the BRCA1 gene. So, thinking about the average woman, typically women have an estimated 12% risk of developing breast cancer at some point in their lifetime. Now, for Sarah, because we know she has a BRCA1 mutation, now we know that her risk of developing breast cancer at some point in her lifetime could be more than 60%. She also has a higher likelihood than other women to develop multiple breast cancers in her lifetime. We also know that her risk of developing ovarian cancer could be as high as 60%, which is significantly higher than the average woman's risk, which is around 1 to 2%. Her risk of developing pancreatic cancer and melanoma is also higher because of this BRCA1 pathogenic variant. So Sarah, she meets with her genetic counselor after her genetic testing results have come back, and they talk about ways to use this information moving forward. So for Sarah, because she has a higher risk of developing breast cancer based on this test result, they talk about a couple different options in terms of her cancer screening and prevention. Based on that breast cancer risk, she would be eligible to begin her annual mammograms along with annual breast MRIs. She could also discuss with her doctors about starting medications that could potentially reduce her risk of developing breast cancer. And she might even consider taking preventative measures by pursuing a prophylactic bilateral mastectomy, which is a surgery to remove healthy breast tissue to reduce the chance of developing breast cancer there. Because she has a higher risk of developing ovarian cancer, she would want to talk to her doctors, maybe even a specialist, about the recommendation to consider removing both her ovaries and her fallopian tubes. Typically, we recommend for women that have BRCA1 pathogenic variants to consider removing their ovaries and fallopian tubes between the ages of 35 to 40. It's obviously a very personalized conversation. If Sarah does not choose to pursue risk-reducing surgery for ovarian cancer, she'd be recommended to discuss ovarian cancer screening options, although the effectiveness of doing ovarian cancer screening is limited. She does have a slightly higher risk of developing melanoma because of this result, and so for that reason, she could consider doing annual dermatology full-body skin exams. And then we'd say that she has a higher risk of developing pancreatic cancer in her lifetime as well. There are certain screening options that are available for pancreatic cancer through more so investigational or research protocols. So this isn't something that people are typically doing if they don't have a genetic risk factor or some other type of risk factor for pancreatic cancer. Eligibility for this type of screening depends on certain factors, so including the age of a person and the presence or absence of a family history of pancreatic cancer. At this time, based on her age, Sarah would be considered eligible for consideration of pancreatic cancer screening at a later age. So when she's 50, this would make more sense for her to talk about. And certainly we'd want her to discuss this information with specialists who have expertise in performing this type of pancreas screening. So we talked about what this means for Sarah, but I've mentioned genetic testing always has some kind of implication for family members. So for Sarah's family, this does have impact on her children, her siblings, and her parents, because they all have a 50% chance to have the same pathogenic variant or mutation. Although it appears more likely that Sarah may have inherited this BRCA1 mutation from her mother, because of that family history of cancers that can be related to BRCA1. It's also important to share information about this genetic test result with people on both sides of her family, just in case this, if this did come from her father, her other paternal relatives would be at risk to inherit the BRCA1 mutation. We would want to make sure that they have this information. We'd recommend that Sarah's children and other children in the family wait until they are at least 18 years old to pursue BRCA1 genetic testing. Okay, so let's move on to talk about our next patient, Alex. So Alex meets with a genetic counselor based on his family history of colon cancer in his father, who was diagnosed with colon cancer at age 45. Alex is 30 and he is unaffected, meaning he has never had cancer. So his father had colon cancer at 45, which means that he was diagnosed with an early onset colon cancer. And this raises the concern that his father may have had a hereditary cancer risk factor. Alex is wondering whether he should consider undergo genetic testing himself. But the genetic counselor and Alex discussed that his father might actually be the best person in this family to do genetic testing because he has actually had cancer. Perhaps he's the most likely person that could possibly test positive for one of these genetic risk factors. If Alex's father has a genetic risk factor, Alex could then consider undergoing genetic testing himself. So Alex talks to his father about the conversation he had with the genetic counselor, and his father decides that he will undergo genetic testing. So Alex's father meets with a genetic counselor. He elects to undergo that genetic testing to look at genes that are related to hereditary risk for colon cancer. And his test results come back negative, meaning that the results do not detect any hereditary cancer risk factors. So now there's a couple possible explanations for Alex's father's history of colon cancer. Firstly, it's possible that his father's colon cancer was not hereditary. That's actually, it's unlikely that his father's history of colon cancer was hereditary because of his genetic test results. But perhaps it was more likely caused by a combination of environmental or maybe lifestyle-based risk factors. It's possible, though, that there's a mutation in a different gene associated with a hereditary cancer risk that hasn't yet been identified and we can't test his father for. And then it's always possible that perhaps there is a pathogenic variant in one of the genes that was evaluated that we just can't identify using the current genetic testing technology. So since Alex's father's genetic test did not detect a hereditary cancer risk factor, the likelihood that Alex inherited any hereditary risk factors for cancer from his father is reduced. But should Alex still think about colon cancer screening? The answer is yes. His risk of developing colon cancer is not zero. So thinking about Alex, the genetic counselor's recommendations for him would be based on his family history of colon cancer instead of the genetic test results. So according to national guidelines, since Alex has a close relative that was diagnosed with colon cancer at a young age, he would be recommended to begin his colonoscopy screening at age 35. And that's younger than he would have been recommended to start his colonoscopies if he had no family history of colon cancer. He'd be recommended to repeat that colonoscopy screening at least every 5 years or sooner, which is different than what we'd recommend for the average person who could potentially wait, to do their colonoscopies every 10 years. So you might be wondering, after this long conversation about all the different risk factors for cancer, is there a way that I can minimize my risk? Is there anything that I can do about this? And the answer is yes. There are certainly things that we can do to try to reduce our risk or at least avoid known risk factors for cancer. So avoiding tobacco use, for example, and that includes trying to avoid secondhand exposure to tobacco use, being physically active, maintaining a healthy weight, trying to limit the alcohol intake that a person has per week. And obviously, 0 alcohol per week would technically be the best. Protecting it against known risk factors like the sun and avoiding tanning beds would reduce a person's potentially, limit their risk factors for skin cancer. We'd recommend trying to protect against sexually transmitted infections like we talked about with respect to HPV. And there are even vaccinations that people can get to reduce their risk of contracting these. And then lastly, something that I think is very important is cancer screening, understanding what type of cancer screening you can be doing and making sure to be pursuing that on a regular basis, depending on your doctor's recommendations. is really important in the fight against cancer. So if you're wondering, I'm interested in all of these different things. I want to know more, but I need a little help. I understand. If you're needing a little more help trying to figure out how to document or learn more about your family history and put it on paper so you can share it with your doctors, you can create an outline, an online shared document, and then maybe share that link with your family members, maybe even like a Google Doc, for example. And that way, everyone in your family can contribute what they know about their health histories and their family histories as well. There are certain ancestry DNA tests that can help you with building a family tree, like that pedigree that we talked about. And then you can find your genetic relatives if you and your relatives have pursued genetic ancestry testing and have opted in to be notified, of your genetic relatives that have also done genetic testing through those ancestry sites. There are also online resources like Family Search, which is an archive of historical documents where you might be able to find records of life events like birth certificates, death certificates, things like that, that may help you understand, how a family member may have passed away, what types of health conditions they may have had. If you're wondering how to quit smoking, there are certainly some resources that may be available to you. The National Cancer Institute has a free national information service that has smoking cessation counselors that are available to answer any of your questions at the phone number listed here. There's also a free service to connect individuals with specific counseling and information resources within their state at the number listed here. It's 1-800-QUIT-NOW. And if you are thinking that you might actually be a candidate to do various types of cancer screening, but you're not quite sure what specialist would be appropriate to do that, you can always ask your primary care doctor. Or if you need help just locating one of those specialists within your network, you can visit this link at ynhh.org/find-a-doctor. So I couldn't do any of this without the help of our awesome team here at Smilow. So this is just a kind of a collection of all of the providers within the Cancer Genetics and Prevention program here. So we are very lucky to have a great team of physicians, a geneticist, multiple genetic counselors, genetic counseling assistants, coordinators, nurse practitioners that make up our whole team. If you and your family members are interested in discussing any of this information further, we'd be happy to meet with you. And you can contact us at the phone numbers and the website listed here. If you'd like to set up an appointment, I would recommend that you ask any of your doctors to place a referral to our program, and we would be happy to meet with you. So that concludes my talk. I am very happy to answer any questions that you might have.
All right, Carson, thank you so much for such a wonderful presentation. We do have a number of questions. So we'll start maybe with some of the easier ones and then move on to some of the harder ones. If someone's had genetic testing previously and results were negative, do they need more testing? And if so, how often should they be repeating that test?
Yeah, that's a great question. I think the answer to that really depends. I think it's a good idea to check in every couple of years, maybe every 2 to 5 years, just to see if there are any new technologies that we can do that we didn't know about when you had your previous genetic testing. For context, 10 years ago, we might have only tested someone for 2 genes, but now we might more so recommend that they be tested for 20 genes. So we're just always learning about genetics, the things that we know about genes and how they function in our bodies, and the technologies that we use in genetic testing are constantly evolving. And so I do think it's reasonable to check in and see if there's anything new that we can do for you.
And then similarly, for someone who's done genetic testing and maybe has had a pathogenic variant identified, how often should they be checking in with their genetic counselor to see if anything's changed or if there's anything new for them?
I think I'd say probably the same kind of maybe every 2 to 5 years, just checking in and, again, our understanding of how these genes function changes. Even that BRCA1 gene that we were talking about, we're still learning and kind of solidifying what we understand about the cancer risks, and then how we'd recommend that people utilize that information with their doctors. So I definitely think it's a good idea to stay in contact with your genetic counselor.
Great. And we had a question about whether for genetic testing, is blood more accurate? Is saliva just as good? What would you recommend in terms of sample type?
I give people the option to choose to do genetic testing through either a blood sample or a saliva sample. There's no difference in the degree of accuracy. The way I explain it is that we're doing genetic testing on your DNA. And we can find that DNA in white blood cells from a blood sample, or from DNA from your cheek cells that have sloughed off into your saliva. That's how we get the DNA. It doesn't matter where it comes from.
Great. And then there was a question about if someone's already had a cancer diagnosis and they're concerned about their risk to develop more cancers in the future, what's their next best step? Who should they reach out to and talk to about that?
I think it's reasonable to talk to any of your doctors and say, hey, is there anything that, is there any reason for me to be concerned that my cancer history increases my risk of developing any other types of cancers in the future? Maybe this is your oncologist. I think that would be a great place to start. But it could even be your primary care doctor, or a nurse, an obstetrician, gynecologist, or a urologist even. So really any of those people would be great kind of resources to then potentially refer you to our program to talk a little bit further. And really, there are lots of different genetic counseling programs across the country that would be happy to see people and talk about these exact issues.
Wonderful. There was a question about if someone's adopted, and so they're not going to have really a family history that's comprehensive, but they're concerned about the possibility of a hereditary cancer risk or just cancer risk based on family history that they're not aware of, what would you recommend to them?
Yeah, that's really tricky. I think oftentimes we assume that people may know more about their family history, and a lot of times that's just not the case. I think about the fact that genetic testing is a relatively accessible resource. So even if we don't have any known risk factors that we can see in a family history, that could still be a reason to consider doing genetic testing. It might just mean that your insurance is less likely to cover the genetic testing, but that's okay. There is a way to pursue genetic testing without insurance coverage. Currently, genetic testing is available for just about $250 at most commercial laboratories.
Great, thank you. And then there were a few questions too about the potential impact of genetic testing on various types of insurance. Could you speak to those questions?
Yeah. I think this is a really common question. It comes up a lot when I see people. I think about the fact that we do have laws that provide us with some protection against at least discrimination in the kind of insurance realm. I think about the fact that there is one law in particular. It's the Genetic Information Non-Discrimination Act, also referred to as GINA. And this law provides you with some protection against having your insurance company, like let's say Blue Cross Blue Shield as an example, or even like your employers, use any information from your genetic testing against you as in a discriminatory way. I always try to mention that at this time, those laws don't necessarily apply to life insurance, long-term care, or disability. So if you already have those plans in place, they're probably not going to be asking you too much about, checking in with you every couple of years, asking if you had genetic testing. It's just that if you apply for any of those plans in the future, they could potentially ask you about your genetic testing history when they're doing their intake, and they potentially could use that information in any of their determinations.
Great, thank you. And there are a couple questions about coverage for genetic testing. Could you maybe just speak kind of broadly about insurance coverage?
Yeah, insurance is it's a tricky beast. I typically think that most insurance companies have policies or criteria where if a person meets the criteria to do genetic testing, they're more likely to have insurance approve coverage of genetic testing. We always talk to people during genetic counseling appointments, not just about whether or not genetic testing is recommended to them based on their family and personal history of cancer, but then we also talk about, do they meet their insurance criteria and what would be the best, most cost-effective way for that person to pursue genetic testing? So the answer is it depends, but it's really helpful to talk to a genetic counselor before doing genetic testing so we can talk about these things.
Great, thank you. And then there was a question as well about maybe the difference between tumor testing and genetic testing. And could you maybe just briefly describe the difference between tumor testing and germline genetic testing?
Yeah. So when a person has cancer, sometimes their oncologist might order something called tumor testing. So we talked today a lot about how a person can be born with mutations that increase their risk of developing cancer. It's something that would be present in every cell of their body. Um, when a person is doing tumor testing, that test is looking to see if there's any specific markers, so specific mutations that are only present in that tumor. And the oncologists want to know about those types of things because it can sometimes lead them to certain types of treatments that could be more effective in those individuals because of those specific markers. So tumor testing doesn't necessarily tell us anything, or in most cases, it's not looking to tell us anything about that person's hereditary risk factors for cancer. It's more so a clinical test used by oncologists to better understand how to treat someone for cancer.
Great, thank you so much. We're right at the end, and we've finished all the questions, so we ended right on time. I just want to take the opportunity again to say thank you to everyone for joining and asking such great questions. There was a question earlier too about whether the webinar would be recorded, and it will be recorded and available on the Health Systems YouTube channel and Vimeo channel as well. And I believe that everyone who registered will also get a link to the recording. So thank you again, Carson, for such a great talk, and thank you everybody for joining.
Thank you, everyone.